research questions can come from a variety of places. Maybe you've been in a clinical situation and you have noticed a problem or noticed something interesting and you want to follow that up. Maybe you've read a paper and you've thought, I wonder if we did that in my circumstance, in my clinical situation, or maybe you've thought that maybe that wasn't done very well and you could do it better. It could come from an idea that your clinical group has for quality improvement. Maybe you've done a really good quality improvement project and you want to build on that. It needs to be something that is very specific and very well tailored to a single idea rather than being about an area of interest.
I think in clinical research it's incredibly important when you start with a research question to have a well-defined question for a number of reasons. The first is that you need really to clarify the project description, to be able to communicate it to others, and to also properly define it in terms of what is your population you're studying, to be able to get appropriate ethics, remembering that ethics for a proposal only covers that very specific project. So if you haven't defined it properly beforehand, you won't have appropriate ethics to do the project you need to do. You need to be able to define the population you wish to have enrolled in a study so you can target recruitment. You need to be able to explain to your co-workers what the project involves because they need to be aware of the work you're doing. And you need to have achievable outcomes. And for all these reasons, you really need to have a well-defined, focused project description.
So if you're using the PICO abbreviation to help you formulate your question, break that down. So P is your population. So describe your population clearly. Who are the people who are going to be in your research project? If you're looking at an intervention and a comparison, again, describe that clearly and define that clearly so that you know exactly what that is. And then when you're thinking about the outcomes that you're going to use, again, be clear, be succinct about what the outcome of interest you have. And then once you've worked out those definitions for each of the components of the research question, then you can glue it together to make a sentence that helps to describe what your project is aiming to answer.
So a good research question can follow the FINER acronym. So it needs to be feasible, it needs to be interesting, it needs to be novel, it needs to be ethical, and it needs to be relevant. I would add to that it also needs to be measurable. So a good research question needs to be simple, it needs to be something you could explain to somebody in one sentence, somebody who doesn't know what you're doing, and it needs to be something that's interesting and novel. It won't get funded if it's something that is of interest to very few people and has no benefit to anybody.
I'll give the example where in our discipline, I'm a clinical gastroenterologist, we've wanted to see whether our complication rate from colonoscopy was equivalent to our colleagues across the state and across the country. So for a quality assurance project, what we did is we simply went through a period of a year of the preceding colonoscopies done over the past year, looked at the complications arising, looked at the type of complications, looked at the relative rate of the complications, and also looked at how successful we were at completing colonoscopies in this population. And that helped define how we performed relative to our peers, and that's a quality assurance project. And I'm pleased to report we performed well compared to our peers.